Hello, my name is Drew Lovett, and this is my medication administration video. I will be administering heparin. Okay, and I'm going to spin you around the room. Okay, I'm going to show you my work area. Okay. All right. So I'm going to start by gathering the proper documents that I need. Okay. Then I'm going to go to the medication administration room. I'm going to shut the door. I'm going to limit all distractions. I'm not going to take any phone calls. And I'm going to limit conversations with colleagues to a minimum. And I'm going to abide by the hospital's no interruption zone policy. So I'm going to be comparing my patient order form, and I'm given heparin. So I'm going to be comparing this heparin to my MAR. My MAR of that medication of heparin. Okay, so I'm gonna start by making sure I got the right patient. So Jaguar J. Jones, medical record number 4176352, medical record number 4176352. Allergy to penicillin, okay, got the right patient. All right, so on my order form, I have heparin, and on my MAR, I have heparin. 5,000 units, 5,000 units. Subcutaneously. Every 12 hours, every 12 hours. Okay, so I'm done with my order form. I'm gonna set this to the side. All right. So I'm gonna start my first 7 rights of accuracy. So first, I got the right patient, Jaguar J. Jones. Right medication. So I have heparin here. Heparin 10,000 units per milliliter. Expiration is 12/5/25. So I got heparin on here. Heparin, okay. Here's my vial of heparin. Heparin 10,000 units. 10,000 units. Heparin 10,000 units per milliliter. Expiration is 12/5/25. Okay. Right route, it says to give subcutaneously. So I have a tubercular syringe, which is good for subcutaneous injections. And right dose. So hand hygiene. Okay. First I'm gonna clean my vial. Clean. Alright. I'm gonna draw up 0.5 milliliters. So there's 10,000 units per milliliter, and my order's for 5,000 units, so I need 0.5 milliliters in order to get 5,000 units. All right, and since this is a clean needle, I'm going to slide it back into the cap. All right, so I have 0.5, okay. 0.5 of heparin, which this is 5,000 units. So I have right patient, right medication, right route, subcutaneously, right dose, 0.5, which is 5,000 units, right time. I do not see where he's had it in the last 12 hours because the order is for every 12 hours, so he's not had it in the last 12 hours. And we're giving it to him to help prevent blood clots. So all elements of a legal prescription are there. Okay, so now I'm going to start my second check of accuracy. So, right patient, Jaguar J. Jones. Right medication, I have a vial of heparin that has 10,000 units per milliliter, and I have an order for heparin 5,000 units. And I've drawn up 0.5 of heparin in this syringe. 0.5 of heparin in this syringe, which is 5,000 units. Okay, so I have my right patient, right medication, right dose, right route is we're to give it to him subcutaneously. So I have my subcutaneous needle and syringe, my tubercular syringe, and right time says to give every 12 hours. He has not had it in the last 12 hours. Okay, and we're giving it to him to help prevent blood clots. So all forms of a legal prescription are there. Okay, so before I go to Mr. Jones's room, I'm gonna make a label for my syringe. Heparin 5,000 units and 0.5 milliliters. Jaguar J. Jones. So heparin 5,000 units and 0.5 milliliters, Jaguar J. Jones. This is going to go in my syringe, and I'm going to be careful not to cover the area of... I'm going to put it below my plunger so that I can still see the amount of medication that I do have in my needle, or my syringe. Okay, so I'm going to take my vial, my syringe, my MAR. Gonna get me some gloves. Okay. Alright, I'm gonna go to Mr. Jones's room. I got my sharps container. Alright. Alright, so knock, knock, knock. Hello, Mr. Jones. I'm here to give you your heparin shot. How are you this morning? Good? Okay. So I'm going to raise his bed up, and I'm going to explain to him, hey, Mr. Jones, I've got this heparin for you. We're giving it to you to help prevent blood clots while you're here staying at the hospital. And I'm going to be giving it to you in your lower abdomen below your belly button. And that's a good region for subcutaneous injections. How are you feeling this morning? Good, okay. All right, and I'm gonna grab some baseline vitals on you. Okay, and I'm just gonna pull your gown up a little bit, but before I do that, I'm gonna start my checks of medication, okay? So let me see your armband. All right, so I'm gonna compare my MAR to Mr. Jones's armband. Okay. All right, so, all right, Jaguar J. Jones, Jaguar J. Jones, all right. Medical record number 4176352, medical record number 4176352. All right, and I see you have an allergy band on, and it says that you're allergic to penicillin, and I have in my MAR that you're allergic to penicillin. Are you allergic to anything else that I need to be aware of? No? Okay, beautiful. All right, so now I'm going to start my last set of medication accuracy. So I have Jaguar J. Jones, all right. Right medication. I have heparin ordered, and I have a vial of heparin 10,000 units per milliliter, and I have heparin 5,000 units and 0.5 milliliters in this syringe. Okay, my right route is subcutaneously. I have the correct needle and syringe for a subcutaneous injection. Right dose is 5,000 units. I have 5,000 units and 0.5 milliliters in this syringe here, and I'm just going to double check that. I have 0.5, which is 5,000 units, okay? Right time, I'm to give it to him every 12 hours, and I see on the MAR that he has not had it in the last 12 hours. Okay, and we're giving it to him to help prevent blood clots. So all forms of a legal prescription are there. All right, Mr. Jones, I'm gonna hand hygiene. Gonna put my goggles on. Gonna put on my clean gloves. Okay, and all right, I'm gonna pull back his gown. All right, and this is his abdomen, his lower abdomen. So I don't notice any bruising or discoloration. All right, palpating, do you feel any pain or tenderness? All right, good. Just gonna clean this area. Let's see, squish it. All right. So I'm gonna clean in an outer circular motion, being careful not to go over any area that I've cleaned already. I'm gonna leave that there to mark where I have cleaned and where I'm gonna be injecting. All right, Mr. Jones. Little poke, 1, 2, 3. All right, and apply a little bit of pressure, and I'm gonna discard this into my sharps container. All right, so now I'm going to get Mr. Jones back comfortable. I'm going to get you back in a comfortable position, get you covered back up, get that bed rail up, and I'm going to let the bed back down. And do you need anything else, Mr. Jones? No? Okay. All right, well, I'm going to go back to the nurse's station, and I'm going to go document that I gave you your heparin, and I'll be back in about 10 to 15 minutes to assess to make sure that everything is still going good. And when I come back, I'm gonna grab another set of vital signs on you, and I'm gonna assess to make sure that you're not having an allergic reaction to the heparin. If you need anything, here's your call light. If you start feeling funny, please push the nurse button before I come back. All right, Mr. Jones. All right, you have a good day.